Thank you, and I apologize for not understanding the way we were doing this. Would you yield for some questions?
Absolutely. I'll do my best.
Thank you. I just want to clarify about women's health funding, if I could, please.
Yes.
And I know we've talked about this before, so really I just want to clarify for legislative intent here. And I very much appreciate all that you've done to advocate for funding in this area. I see in Rider 161 that we're assuming Texas will receive a federal 1115 family planning waiver for FY 2019, allowing us to draw down $90 million in federal matching funds. That's the assumption at this point. Is that not correct?
That's correct.
So, we clearly know that there are times with the federal application, it takes time for that to be approved. We don't yet know what things are going to look like. So if the federal government does not award the Texas matching funding for our Healthy Texas Women program, or if it's less than requested, or if there's a delay in the receipt of those federal funds, is it the intention of the legislature to fund the Healthy Texas Women program at least the same level as today, even if this requires state funding that's not assumed in this document?
That is 100% the intent. When the Senate passed their version of, when Senate Bill 1 came over into conference, they had $180 million for women's health, but it was 100% of federal drawdown dollars. And so working through conference and working with the agency, it became obvious that it is unrealistic to assume that any federal dollars would be available in fiscal year 18. But the agency was certain that they would receive it in fiscal year 19. So we changed the rider, and the Senate in conference had to come up with $90 million in GR to replace this assumed federal dollars that I didn't have confidence was going to exist. And then the end of the rider, that if it is absolutely the intent that they will find that GR if we do not get the federal dollars. That's absolutely the intent.
So we're assuming that we will get it by FY19.
Correct.
If we do not, then we still intend to find state dollars to fully fund at the current levels.
Yes, that is absolutely the intent.
Okay, I appreciate that. And the family planning program will not be part of the 1115 waiver application, but this, of course, is a very important safety net aspect for women's health. So is it the intention of the legislature to maintain current funding, eligibility, and benefits for the family planning program regardless of the receipt of the federal 1115 waiver?
Yes, absolutely. And we also have a rider in there, I think, exploring auto enrollment. That one may not be in there. But no, it is 100% the intent to maintain levels for family planning regardless of the waiver.
Okay, I appreciate it. Thank you so much.